So I'm currently in the office of the Major Director of the Ghana Health Service right here in the Cape Coast in the central region of Ghana, and we're here to interact with him on the uh, cholera outbreak and how the response has been so far and the activities that has been undertaken since the outbreak. Ghana Red Cross, we are one of the partners when it comes to health delivery, largely widely in Ghana as well. So, good evening. Thank you for your time.
Good evening. Thank you for coming.
So, as a sector, you had your plans and ways to, combat the outbreak as well. But what additional service did Red Cross bring on board to, be of help to the fight against the outbreak?
Oh, okay. Thank you. You know, outbreak are emergencies,
Mm.
and sometimes emergency can come whether you are prepared or not. Cora, as you know, is a WASH program. That's water, sanitation, and hygiene. Cape Coast was battling with water. We've been battling with water for over 4 months now. The sanitation is not good. And since, in a way, we dealt with COVID and people were no more afraid, the hygiene aspect, the personal hygiene, environmental hygiene aspect also went down. So we visited the health promotion unit, liaised with the Red Cross. They came in first with the Veronica bucket, which was so helpful. They were the first people who came to our aid. They donated about 10 of the Veronica buckets to us. They went further to give us knapsack spray. The environmental health unit at the Metro Assembly, they had they had some chemicals. It wasn't enough. Their sprayer machines were also enough. So when Red Cross came in, they came to augment the existing effort. They gave the machines, which of course help in the fumigation of the affected houses. We initially started with the homes of affected individuals, and we later on moved to schools, hospitals, and other social places. And concerning the community door-to-door education, we don't have enough staff here. Somewhere, some other districts, they may have volunteers who are willing to do the things freely for them, but that doesn't happen in Cape Coast here. So when Records deployed about 46 of their staff or volunteers to the community, it really relieved us a lot because they did virtually our education for us. They paid the community information centers, some FM station for a period of 3 months to be doing all those things. So since this Cora case bordered much on behavioral change, Red Cross more or less took that aspect, that burden from us because the education through all other channels really helped us.
We all know that when it comes to the issues of vaccination, a lot of people are hesitant to take jabs with regards to issues like that. How are you able to manage, to get people, the collaboration you have with Ghana Red Cross, how are you able to manage to get people to come out for the vaccination as well?
Okay, thank you. Cape Coast is a typical vaccine hesitant community. At a point in the history of Cape Coast vaccination exercises, we have anti-vaccination crusaders. If you go, you give them education, they will come and counter through information centers and other things. But this time around, everybody is even surprised
Okay.
about the 95% that we had. Um, this is basically due to maybe the strategy that we use. Red Cross started the work is it a week before the actual exercise. They were in the communities mobilizing them, and we also trained them as our mobilizers for the campaign. So they joined the teams to go around during the campaign, and their main duties were one, to move house to house to inform people of the vaccination teams coming, and two, try and educate, give deeper information about the vaccines to people who were hesitant to taking the vaccines. So I think it is about behavioral. So the mobilization, how we did a social mobilization with the Red Cross team, helped achieve that feat. About 95 is unprecedented. And adult vaccination is not easy. If it comes to children, that one we have less issue, but adults 1 year and above, especially the youth, it wasn't easy. Adolescents, it wasn't easy, but because we had people visiting them, being visible in the communities and other things, we had it smooth.
Okay.
They were also doing, even they did some of the things that we were not even privy to. Sometimes they will be on air educating, sometimes they will do some other engagement with their stakeholders within the communities. And it helped. And the national officers were around, regional officers were around throughout. And they had their car supporting some of them. They were transporting some of the vaccines to the places. They really, really did well in the campaign.
So going forward, what do you expect also from the Red Cross?
Yes, the expectation is that cholera is one out of million diseases that we deal with. Even as we speak, we are investigating some other few conditions that have been reported at our facility. So the collaboration with them, we want to strengthen it. We want to pray with them that there are still gaps. There are still gaps in the healthcare delivery. So anytime we call on them, they should come to our aid if they have the means to do so. And I don't know how their volunteers operate, but if we can have them work at least for the rest of the year, it is going to help us. It's going to help us. If the disease can travel beyond 2 life cycles and other things without resurgence, I think it's going to help us.
Okay. All right. So thank you very much. We're so grateful for your time.